Hi, everyone. We're going to get started in a moment, but welcome. Okay, it's just past 1 o'clock, so I am Lauda DeDominicis. I'm the Executive Director of Nurturing Minds, and I want to welcome you all to the Nurturing Minds and SEGA COVID-19 response, our second webinar. I'm going to go over some housekeeping first before we get into our panelists. So this webinar is recorded, and all of you are on mute. You've probably figured out by now. We really will encourage you very much to be asking questions, especially after our panelists have had a chance to speak. And so you can do that using the Q&A button or icon at the bottom of your screen. We're going to try our best to answer all of the questions that we can before our hour is up, but if we miss your question, then we'll try to get back to you directly. And as with last time, Samantha will be reading off your questions to the panelists at the end of that time. There's a couple other things. We actually have a pretty exciting announcement to share with you all that we received notification early this morning. Yesterday, there was an announcement by the Tanzanian government that high schools, secondary schools like SEGA, and primary schools will reopen in Tanzania as of June 29th. So universities and 1 year of advanced level high school opened a couple weeks ago, June 1st. We're actually quite happy with this news because of the negative ramifications of especially adolescent girls staying out of school for long periods of time. So that is good news to share. And also, I'm just going to take a few minutes to go over some of our response that we have had over the past several months. We did have a webinar a little over a month ago, but for those of you who didn't have a chance to attend, we wanted to make sure you knew some of the things we did before moving on to a more recent update that our panelists will share with you. So schools in Tanzania did shut down as of March 17th, and we had about a day or so to get all of our 260 girls back to their 25 home communities. Which we did and managed to do that where they all got home very safely. We immediately put together this COVID-19 task force, which is made up of both SEGA and Nurturing Minds leadership, as well as bringing on board several medical professionals, including Dr. Orinda, who is here again with us today. That task force meets weekly and has just been addressing all of the various challenges that have come up. We did have a number of challenges that we needed to face immediately, and that is especially because a lot of most of our students come from very poor backgrounds. So as they return to their communities, they were faced with limited access to electricity and running water, for example. One of the things, of course, we all need to wash hands during this pandemic, and also facing inadequate healthcare system, food insecurity, and an increased risk of pregnancy and early marriage and violence, unfortunately, and also, of course, maintaining their education while living home and being remote. So those were all of our challenges that we have faced, and our immediate response was to develop individual emergency packages for our students, and we also have done various things for the girls that we serve in our Modern Girl Community Outreach Program. So there are 900 girls in that program as well, and 38 mentors and recent graduates of SEGA who work with us to support those girls in that program. So in that emergency package, it included educational materials for remote learning for the 260 SEGA students, also educational materials on COVID-19 prevention and response. That went out to our students and the Modern Girl girls, so to over 1,200 girls in Swahili. And our students also have, our staff at SEGA have been reaching out weekly through phone calls to our students to check in on their well-being. And all of our students and the girls in the community outreach program have also received masks. So as of today, our staff there made 3,600 cloth masks that went out to over 1,200 girls. 1,200 girls also received soap, and our students got personal letters from many of their sponsors, as well as letters coming from school groups and other supporters, which we think was very helpful for the girls' mental health. And pamphlets containing information on women's health also went out to all 1,200 girls as well. And also we started initially with a cash transfer for food for 33 families who were the most in need of our SEGA students. But just in the past several days, we've expanded that so that all 260 of our students have received or are receiving also cash transfers for food or other immediate emergency needs that they may have. Our mentors, who are part of the community outreach program, also received some small grants to start businesses for income generation. And finally, Nurturing Minds and SEGA were able to share our COVID-19 information materials in Swahili with dozens of other similar nonprofits serving adolescent girls throughout East Africa so that we could expand that knowledge as much as possible. Thanks really very much to our supporters and all of you. We initially raised over $50,000 in emergency assistance through our COVID-19 emergency fund, which is fantastic. And we've just learned that we have received a $25,000 matching grant for emergency assistance from a foundation. So that is a one-to-one match, which we're very excited about and can essentially double the amount of funds that we will be able to use for emergency assistance for our students and the girls in the communities. So that's just a quick synopsis of the things that we've done. Now I'll turn to our panel, and I'll just introduce all of them first, and then they can move to their comments. So we have again Polly Dolan, as we did last time, our co-founder. She is the co-founder of both SEGA and of Nurturing Minds. And prior to starting both organizations, Polly was living and working in Tanzania for over 10 years on girls' empowerment and education issues. She primarily worked with CARE International. Polly holds an undergraduate degree from the University of Vermont, where she received the 2019 Alumni Achievement Award. She also holds a master's degree in economic development from the School of International Training in Vermont. And Polly is going to share with us just information and an update about the situation on the ground and how our students have been doing in the past month. Sarah Hewitt is a board member of Nurturing Minds. Sarah first met SEGA in 2014. When working with the Population Council on adolescent girl programming, and worked in Tanzania from 2015 to 2018. Sarah actually helped us start our Modern Girl Community Outreach Program. She is currently a program officer with the Economic Justice Program at Open Society Foundations in London. She holds an MBA from the Kellogg School of Management at Northwestern University and a BBA from Emory University. Sarah is going to share some of the information on effects of the crisis on girls and women's health and the importance of a strong response in terms of counseling and information sharing so that they can avoid many of the pitfalls that come with crisis situations, including unwanted pregnancy and marriage. Juma Ali is also with us today. He is a founding board member of Nurturing Minds. Juma has worked extensively in relief, environmental conservation, and community development in his home country of Tanzania. He worked for CARE International for 6 years before moving to the US. Juma currently works as a contracts manager for a global health organization based in Pennsylvania. Juma has a BS in business administration from Spalding University and an MBA in management from Eastern University. He firmly believes in the magnificent potential of the people of his home country and brings his unique understanding of his work to Nurturing Minds. Juma is going to share with us the new protocols that SEGA and our task force have developed on how the school can reopen safely. And finally, we have Dr. Vincent Orinda, who's joining us again. Dr. Orinda is a member of the Nurturing Minds and SEGA COVID-19 task force. He has vast international experience, having worked for the United Nations for over 17 years. Prior to joining the UN, Dr. Orinda was a senior lecturer in pediatrics and child health at the University of Nairobi Medical School. He holds a medical degree and a master's of medicine in pediatrics, in addition to training in clinical epidemiology as a fellow in the International Clinical Epidemiology Network in Australia. Dr. Orinda is joining us today to answer any medical questions that any of you may have. Without further ado, we'll start with Polly. Thank you.
Thank you, Lauda. Yes, as Lauda explained, all the different things that SEGA has been doing, one of the best things that has helped us has been to contact the girls weekly, the SEGA girls students, also contact the graduates via WhatsApp, a group that we have where they can write in at any moment and get response from the counselor, and working with our mentors in the Girls Clubs program, or Modern Girl. So the mentors we have not been able to run our clubs because gatherings have been, large gatherings have been forbidden, but we've continued to operate in a safe way with our mentors going house to house. So we've been able to learn a lot about what's happening on the ground. And Tanzania has taken a very different approach than other countries, whereas there hasn't been a full lockdown, but there still has been serious economic impact because from the beginning, tourism came to a complete halt, and it is one of the top 3 GDP earners in the country. So that's affected everyone. And also the borders have been closed, so it restricts commerce, and it just has caused a decline in most people's livelihoods. And we see economic issues, social issues such as domestic violence and child labor and gender issues affecting our girls. For example, for one thing, the fact that all of our students are now at home, it's a little bit harder on the families economically because normally these are girls on scholarship and SEGA is providing meals. So they have higher demand for food. All of their children are home. The economy of every family has been shaken. So the children, especially girls, especially in Iringa, but everywhere I'd say, are being put to work for long hours on people's farms for money. So depending on the level of a family, you'll either have your own land, or if you are so poor that you don't have anything of your own, you might borrow people's land or get paid as a day laborer. So we're seeing a lot of our girls are being hired to work on other people's farms, but they don't get the money. They have to turn in their day's wages to their guardians or families when they come home. So it's not just for a few hours, it's all day, it's hard. There's also cases of students, girls being left at home to care for their younger siblings, but left without food from morning to night. The girls have to stay home and take care of their kids. In one case, we have a girl who lives with her father, but her father is out working. He's rarely at home. She's fortunate enough that a neighbor has taken her in and is having her help out in their tea room, so she's able to eat during the day. But sometimes her dad doesn't come home at night and she's alone in the house at night. So these kind of cases are cropping up a lot. There's also some increase in domestic disputes where A lot of our students are often orphans or living with relatives or non-relatives. So now there are the biological children and the guardianship children in the same house, and sometimes there are cases arising where there's conflict, and some of our students have had to move out to other homes. Now, all of this, there's also one other feature which is being talked about a lot by the girls, is the pressure from boys and men and potential husbands, and the risk of getting pregnant is very high. In those cases, we had one graduate who, her family was under great pressure to marry her off. She comes from a culture where marriages are arranged by parents, and someone brought a lot of cattle to her house and was offering them. But her mother, she's Maasai, her mother refrained and said, no, we really don't want this. She's in college now, and she's now safely back at college. But these are the issues they're facing. I think I have a moment. I can talk about MK response to this, the Modern Girl Program response, Lauda.
Yeah, sure.
Okay. So right now, our mentors, we have 900 girls in clubs across several regions of Tanzania, and they are facilitated by mentors who are graduates of SEGA. And right now, our mentors are going door to door to the girls in their clubs to the extent possible. In most cases, it is possible because they are geographically arranged. So they've been going routine basis to talk to the girls, find out what they're suffering from or their issues or what opportunities they have, and to support them and to help them strategize where possible. And we also have those mentors, and our field officers, our staff, have been working very closely with local government, which is really important in any country, but especially in Tanzania, where it has a very decentralized system where every 10 households has a leader, and you should involve local government in everything. So we reach out to them if there's a conflict or something bad going on in a family that looks like it's escalating to a point where it might need a social worker or a village or a street leader to come and meet the family and try to help resolve. So we involve them at different stages to make sure that any decisions that our staff are making are do not come as a surprise, and that we take the right action within that context. But our staff and our girls, our mentors, are organizing meetings with parents or teachers to try and sort out these type of domestic issues. And in times of high need, sometimes they've offered a bit of financial support from the pockets of the mentors and the staff or the budget. And mostly the needs are for emotional support, though, and talking through and helping them identify the community resources to help them. And of course, like in any community, it depends on the leadership of that local leader. So sometimes there's great support from the local leader, and other times the leader says, this is a family thing, I'm not going to get involved. Although generally in Tanzania, those local leaders are expected to get involved. Also, the SEGA mentors have had a role in raising awareness about this disease. Now, generally in the streets now, there is not a lot of discussion about it, and it's not really a topic that is encouraged. But through that door-to-door reaching out, and through providing, we had provided them with soap. Some of the clubs got money to make their own businesses, and they've been going door to door to sell soap or to, they appear in masks and to give information. So they've been asked by community members, oh, can you teach us how to make soap? And they've also been able to learn about the virus thanks to the pamphlets that we provided to the girls. So that's briefly an update on what's happening.
Thanks so much, Polly. And we'll move next to Sarah Hewitt.
Thank you. So Polly gave a lot of information from the girls and the mentors and the community at SEGA. And I think that's really coming from the approach we've taken. So when we started as a task force, we wanted to make sure that we were drawing on all of the information, the research, the evidence that we could, because there have been crises where we've looked at what happens to girls. So the Ebola crisis in West Africa drew some lessons. There's other emergencies or humanitarian crises where organizations have been able to learn from the girls. So we know that COVID-19 has disrupted education for more than 1 billion students. And the research estimates that up to 10 million secondary school aged girls might not return to the classroom. And this is because of harmful gender norms and also financial strains on a household and on the government. So during these crises, adolescent girls are one of the groups that are most at risk. And girls are unfairly expected to assume adult roles and absorb the shock of this crisis, often with their unpaid labor. So the girls are at great risks when they're out of school. We've heard some of them from the girls themselves. So they're going to be vulnerable to early marriage, early pregnancy, the pressure to take on the unpaid work or the paid work. As the recession continues, they may also lose earnings from other livelihoods that they had before. So we can say that the girls are going to be suffering from violence and discrimination. And the increase in gender-based violence especially has been called the shadow pandemic because it's so widespread. And yet it's not really getting adequate attention and resources. And while this desk research and evidence is a good first step, SEGA and Nurturing Minds really wanted to make sure that we understood the experiences of the girls themselves so that we responded to their specific needs. So we really, through those phone calls, started to hear from the girls themselves, and their experiences were informing our responses. So as we called the girls, it wasn't always as straightforward because they were moving sometimes between households, they were working in agriculture, but you had some girls that were in urban contexts and some that were in more rural contexts. There was one girl who had lost her home and was living in a tent. So it really, the response had to depend on the needs of the girls. And we responded to meet their material needs of shelter and food and soap, but we also wanted to respond to their mental health needs, to understand what their fears and dreams were, and to make sure they were still dreaming about their future. So last week we reached out to one of the students to ask how they were doing, and she responded immediately, even though it was probably quite late at night. And she said, "I'm feeling so good to go back to school, but I'm worried. I'm worried because one way of staying far from COVID-19 is to stay far from one person. If you look at the way we live at SEGA, it will be very hard for us students. Also, I'm glad to be back at home. I can say I'm a helper to the people around me because I try to educate people about COVID-19. At home, I am trying to wash my hands all the time." So we responded again and said, "Don't worry. When you return to SEGA, Madam Ellie and the teachers and Nurturing Minds were all working to put a plan in place to keep you safe from COVID, and Juma is going to talk about that in a few minutes." So in our response, this communication challenge is just so important to counter that fear and the isolation that girls might be experiencing. In the Education for Life materials that we sent to the girls, we worked with we used some of the partners' materials in Tanzania because they're already in Swahili and they're designed specifically for teenagers. So we have printed some additional copies of a magazine called FEMA, which is produced by an organization called Femina Hip. You can find it online, and it's a really glossy, colorful, fun magazine. I've seen in a remote part of Tanzania a teenage boy having an old copy. So hopefully these types of materials are engaging the girls, helping them to stay positive before they return to school. The last thing I'll say is the fact that the staff and the mentors are going to visit the girls in person while keeping some safe distance is really important. Because the girls haven't been able to meet in their clubs, for example, in the Modern Girl program or in the schools, having that person that they can trust and can communicate and troubleshoot with is really valuable. And as Polly explained, those mentors are able then to reach out to community leaders to resolve any issues they might be facing. And we know that there have been issues of child labor and neglect and violence. So making sure that the voices of the girls are heard through this process and that we're really listening, I think has been key to the way that we respond.
Thank you so much, Sarah. I will move to Juma.
Hi, everybody. Thank you so much, Laura. And thank you to all the people who came to our webinar. We just want to thank you for all your support to Nurturing Minds and SEGA. As you all heard what Laura was saying, His Excellency President Dr. John Magufuli has ordered all the schools at all levels to reopen on Monday, June 29th. And on June 1st, I think all the colleges and universities, they went back to school. So we are waiting to hear back what's going to happen to all levels, which SEGA is part of. And today at the Parliament, President Magufuli ordered that the school will be open on the 29th of June. So the COVID-19 task force has been working to prepare for school reopening. And in that regard, SEGA, with the support of Nurturing Minds, have prepared a comprehensive protocol to ensure that there is a safe return to school. And the aim is to keep all the students safe and free of coronavirus in school and quality learning. This protocol for reopening school is designed as a flexible tool, highlighting all the factors that will make this experience successful for the parents, for teachers, and the wider community as a care family, the SEGA family. And this protocol is conformed to the guidance provided by the Minister of Health, which was given to all the head of schools by Minister of Health on May 27th. And we believe that this protocol is good case study for all the schools in Tanzania and elsewhere. So the school systems are also infrastructure, budget, supply chains, and policies and culture will be the main ingredient to make this experience great after reopening the schools. And some of the measures which are under the protocol, we make sure that we have the signs on the school entrance that will promote everyday protective measure, and such as proper hand washing, proper wearing face mask, and we are planning the physical and distancing and sectioning of the spaces, like the dining area where girls will be having food, and also by marking to direct foot traffic, which will help students. And also we give, there's instruction like no shaking hands, no hugging. Also, the temperature checks for anyone entering the school campus will be administered using thermometers, and the school will set up a quarantine facilities for the students who have fevers. And portable hand washing stations at entrance and common areas will be set to promote regular hygiene. And all these can be made at a reasonable cost. So I'll give you some of the stuff we need during this time. We will need the 24 hand washing stations, which will cost around $2,700. And we realize we have to hire 6 buses, making sure the girls will not be going back to school, the public transport. So we'll make sure that we have 6 buses with the cost, which is around $1,700. And we'll need over 1,200 masks, like average of 4 by each student, which will cost around $500. Hand sanitizers will be costing around $450. We need teacher overcoats, which will be costing around $270. And we'll be in need of face shield. Thank you to one of the board members who donated 60 face shield, which were shipped to Tanzania. And we'll need around 12 thermometers. The cost will be around 1,000. 6 projectors and pointers for social distance learning by teachers on campus, which will be around 4,500. And cleaning supplies and material for school, around $800. Dining tables and benches for social distance eating will cost around $2,000. So consider wearing masks will be enforced all the time among students, and enhanced cleaning of surfaces will be another vital element to promote hygiene around school. Students will be frequently reminded not to touch face masks and to wash their hands frequently. Student and staff will be maintaining social distancing. That's around 2 meters to the best of their ability, and all the time when meal times. There will also be a focus on learning recovery process. Like we know, the girls have been out of school for 3 months, and so we'll do from assessing learning outcomes during school closure and ensuring the girls, like what Sarah was saying, the girls' social emotional well-being, and taking measure to support the teachers and their professional development as essential tasks to success. And we will also continue with the current consultation and communication between parents, teachers, and students and community at large in order to understand concern and address them while waiting for school to reopen. Thank you.
Thank you so much, all of you. Thank you, Juma. So I don't know if I can't quite see if we have questions yet. Samantha, I know we did receive 2 questions in advance through the registration of the webinar. Perhaps we can start with those 2, and if others have questions, please do share them through the Q&A at the bottom of your screen.
Great, thanks, Lauda. So the first question that we can start from is a follow-up to what Juma was talking about reopening the school and different measures that are being put in place. So this question is from Diana Lindwasser. She wants to know, with the need for social distancing and the close quarters of the dormitories, how many students can SEGA accommodate safely? And how many students do you estimate will not be able to return at all?
We plan on all of the students returning because that's originally we were told most likely only national exam candidates would come back, which would be Form 4 and Form 2, roughly half the school. But now it appears everybody is coming back. And the context is that we have to follow what we're told while doing things in a safe manner. So we're focusing on keeping the dorms well ventilated and sleeping head to foot. So whereas two girls would have had their heads in the same direction, normally we're having one on one bunk face the reverse direction. And that's what we're doing with regard to the sleeping situation. Juma, if you have anything to add.
Oh, that's all. I think that, like what Polly said, our expectation was maybe Form 4 will come first because they are doing exam. Because Form 6 went first because they are here. We thought Form 4 is going to come back, but now all the girls will be coming back. So we are looking to a column and just making sure all the safety procedures are in place.
So they've taken all the curtains down, for example, to allow the air to free flow in. We have screens on all the windows, and then they'll be in the reverse positions. And of course, all the other measures of trying to prevent the virus from getting onto the campus to begin with.
Thank you.
Great. And then next up, we have a couple questions from Judith Bruce about community efforts and what Girls and Mentors are doing. So the first is, how are the Girls and Mentors in the Modern Girl program leading community efforts? I know you touched on it a bit already, but if you could expand about that a little bit more. She wants to know also about how these girls' spaces have been empowered to give support to confront the problems of compliance or increases in household violence.
Thank you. Yeah, this has been a good test almost of our club's program, because at first we thought, oh, well, we can't operate because there's no gatherings allowed. But we quickly rethought that and realized that we have such a network, and it's an opportunity to get the information out there and to find out how best to support the girls through this time. And that's what we've been doing. So it's really been effective and been an eye-opener to us about the availability of this network and direct link to what's going on. Our mentors, who are all graduates of SEGA, well, almost all are graduates of SEGA. We do have some that had graduated from the program itself that were particularly strong that became mentors, but they've all received training, ongoing training and support throughout the whole time that they've been mentors. So they know how to field a lot of different situations. And we focus it within the context of the local community and the resources that are there. So it's helping the girls troubleshoot when they get issues such as, I'm getting persecuted by my stepmother, or there's a male in the house who is trying to rape me or something like that. These things happen all the time. So our mentors are trained to support the girls, to know who they can reach out to in the community. And of course they can go to the mentor, but it's how do you build that understanding of the resources that are there. And then the staff are the next level up of support and working together with the local authorities, like I said. But regarding the pandemic itself, they've also really ended up playing a role in spreading awareness about correct information about the use of the soaps that we gave, and even how to make the soap.
That's great, thank you.
Thanks. It looks like we have another question from Diana regarding staffing at the school. She wants to know whether the school plans to hire someone to supervise and maintain the protocols and extra cleaning responsibilities that will be necessary in classrooms and other public spaces.
I don't think there's a plan to hire in, but I think we are planning to use the girls, the prefect from each class, for monitoring purposes. So those prefect who where prefects, before the school was closed, we'll be using them for monitoring purposes, making sure everybody have their mask on, making sure that everybody is washing hands. And so we will be doing a lot of training and teaching and awareness creation for this new norm. But there's no plan to hire a specific person unless.
And these are the prefects, as Juma mentioned, are leadership positions at the school that all of the girls held. And there are things like environment prefect, and there are lots of different roles that the girls already had. They're elected positions. And so they're used to taking on those leadership roles, which is great. So I actually have a question about how are SEGA staff able to determine the level of need of each SEGA girl and her family? In deciding what to give them in terms of cash transfers for emergency assistance. I don't know if Polly can take that maybe.
Okay. Well, first of all, the staff have an in-depth understanding of most of the girls, because during the selection process, every girl gets visited in her home, and that's when you really see the situation. And then during the first months on campus, a counseling session is done with each girl, between the girl and the counselor. And over time, your knowledge just grows. So there's the background understanding already of each individual situation. But then the phone calls that we've been doing weekly, the matrons and the nurses have been calling the girls and asking specific questions, such as, initially it was, have you harvested crops yet? How many meals are you eating? And initially we picked out the 33 most vulnerable to provide support to. Then there were some visits. The headmistress went on a visit to a few select girls, but it was an indicator to her that we needed to do more to understand the situation, because she saw the real need, and it was not always coming through in the phone calls. So they had to add some questions to the calls. So it's a combination of guesswork and asking and your own background information, and when in doubt, to err on the generous side.
Okay, thank you. Samantha, I think there's a question from Sheila.
Yeah, Sheila wants to know, what is the overall status of the epidemic in Tanzania? Is the number of cases decreasing to justify the schools opening?
Perhaps Vincent can take that.
You're on silent.
You're on mute, Vincent.
We can't hear.
The overall situation in Tanzania is not really known now, basically because the testing and the reporting of cases by the government was more or less, in the first place, was not have enough capacity for testing. But at some point, I think they decided just not to keep testing and keep reporting. So we don't know really what is the situation. But if you look at the neighboring country like Kenya, where testing is going on, it looks like the number of cases that they test, or the number of tests that they do, and the positive rate that they find is something around 5% of those who are tested are more or less positive. So we don't know. I don't see that the situation in Tanzania will be very different from the neighboring countries. So though we are not getting any reporting from Tanzania, it is obvious that there must be a level of occurrence in terms of the prevalence of COVID-19, and we will not know. What we have discussed in the task force is how people are reporting the deaths that they're seeing in their communities, either through social media or through other channels. And from our last discussions, it was more or less agreed that the monitoring, if you take like the 900 girls that we have spread all over, that if there was an increase or a surge in number of deaths, they would probably be aware of them. But it seems that the social media is not reporting increasing numbers of deaths. So we don't know what's really happening. The answer is that the number of cases may be there, but they're not really reported.
Thank you. Polly or any of the panel, have you heard of any students that have tested positive for COVID or have been reportedly seriously ill during the last 3 months that they've been at home?
No, the reports are always that the students are okay, the girls are fine. So far, we've not heard of anybody among the student body who's been sick, seriously sick.
In terms of protocol, what would happen to a girl if she gets sick while on campus once the girls return?
Maybe I can check that. Yes, in the event that a girl or a student is found to have COVID-19 symptoms, the protocol is clear, and it says that immediately information will be shared with the nearest health facility. In this respect, there's the nearer one called Kingo, and then the case would then be directed to the facility, and while there's still consultation with the facility, the student will be more or less isolated or quarantined in a house that was formerly occupied by a school counselor, and will be kept there until further directions are received from the facility. And where the students has to be cared for in that facility, that an off-duty nurse would provide the services necessary. Obviously, the facility would be cleaned and disinfected regularly, and the overall objective, of course, is to keep the girls safe and free of COVID-19 in the entire school.
Thank you. Will students and teachers and other staff be tested when they arrive to campus?
Vincent, you wanna take it?
I think the protocol is clear on that, and on arrival they'll all be tested, basically using thermometer is a temperature testing. They'll not be receiving any COVID-19 antibody tests or other tests, but monitoring the symptoms and also taking temperatures, that will be done.
Thank you. So Samantha, I see you have a couple more questions.
Yes, the next question is from Angela, and she wants to know how the SEGA teachers and staff are feeling about going back to work.
That's a great question.
I don't know.
we just found out today that the kids are going back. So
Right, but it's a great question. We should find out. But every time I've been talking to people recently in Tanzania, many people have felt, in Morogoro especially, have felt like things have calmed down a bit. I don't know if there will be less fear than there was. I'd be projecting. I honestly don't know, but we need to find out.
And most teachers do come back and forth to school on our private transportation, correct, Polly? So that's also something that, they won't have to be taking public transportation to get back and forth to school. One of the things that Juma mentioned was that they'll be given kind of an overcoat to cover their clothing from the outside. They will, have their temperature taken when they enter. They are going to be receiving shields like the medical style you see in the hospitals versus just the cloth masks, because we felt that when you're using a cloth mask, it might be hard for the kids to hear the teachers when they're teaching, and it might get particularly hot as the weather is much warmer there. So although luckily we are heading into the cooler season in Tanzania, so that will hopefully make it a little bit easier for the girls to wear their masks for the first few weeks to a month. They will need to do until everybody's been on campus together for a few weeks. They will, they will be protected. We are, protecting them and the students by using things like projectors so that they can be more distanced in the classroom, for example, from the students, and having that ability to stay socially distanced from other staff members and from the kids as well. So hopefully those will all be things that will, keep their minds at ease and make them excited to come back to work. I'm sure they're eager to get back to their passions and their missions too in teaching the girls.
Great, thank you. There was also the suggestion that maybe we could do something to thank them for everything that they've done the last few months. This is not an easy time for anyone, and so wanting to give them some recognition.
That's a great idea. They have really worked so hard, even while home, they've come in. I think they are allowed to have 3 staff people in at a time. They've worked really hard to prepare those remote learning packets, and then when they've been collected and they've been grading them, and so now they'll be preparing, I'm sure, to do some remedial catch-up work, as I don't think that the girls have been able to really stay completely up to speed while being at home, especially as a lot of them have had to do farming work and domestic chores. And as we saw from some of the home visits that Ellie and her staff went on, that they weren't able to really do as much work at home as we had hoped. So they've definitely been working very hard, the teachers, even while they have been not on campus full time. So yeah, that's a great suggestion.
The next question is about how someone could contribute to the matching fund for the emergency fund.
That's a great question. People can contribute just the way they would to make a donation. If you do it online, you can make a comment. If it's for the COVID, the emergency fund, then anything that comes in moving forward, it can be matched 1-to-1. If somebody wants to mail in a check, you can also just put a note that it's for the emergency fund, and it'll be matched dollar for dollar by this $25,000 contributor. So thank you for asking that question.
If there's any other questions, feel free to include them in the chat. In the meantime, Lauda, do you have another question prepared that you'd like to pose to the panel?
Yeah, so one thing I was thinking people might be curious about is if the cash transfers that we have provided can be used for other things, or if the students are just being told it's for food, or if it could also be used for medical assistance. Perhaps Polly could take that one.
Oh,
sorry.
No, it's just meant to relieve whatever pressure they're under. So if food is their most pressing need, or medicine, or a combination, they can use it however they want.
Terrific. And I know we heard a little bit about this from both Polly and Sarah, but have you heard anything from counselors or students about girls being pressured into marriage or other risky behavior since they've been home?
Well, the situation that some girls are in about being left at home to care for younger siblings and not having any food, that directly leads to that risky situation, because that can be a way of making ends meet. And definitely just by the nature of their age, and they're at home, and there's boys around, of course, the risk of getting pregnant is there. There's a lot of pressure. The girls have been talking about it a lot, to the extent that they're really looking forward to coming back to school. A couple of students, I mentioned already that one was under pressure to get married, but fortunately her mom helped her, and Sarah mentioned another. So definitely that's one of the biggest things that came out of that Ebola pandemic, or epidemic, sorry, in West Africa, that we drew upon, realizing that we need to ward this off as much as possible by giving the moral support, the talking and the visits to the girls, and the educational materials, because we know they're under a lot of pressure.
Right, and in that instance, 65% of girls became pregnant and weren't able to return to school. Is that correct? That's an increased.
Yes, pregnancy among teenage girls, yeah,
yeah,
rose by 65%. I think that's.
And I would add that although we fully expect every student to come back to SEGA, the girls that are part of the clubs are going to face a prolonged period of risk from COVID, the health impacts, but also the economic impacts over the coming months. So making sure that those clubs are able to continue to reach out and provide that connection and support, that peer learning and peer troubleshooting is going to be really important to helping them avoid a lot of this risky behavior and some of the impacts from the community and the situation.
Thank you. I think we have time for maybe just one or two more questions, Samantha.
Yeah, we have a couple more lined up. Could you say a few words about the school program, especially in terms of what kind of catching up needs to be done, particularly for the girls who are going to be taking the exams?
Can you speak to that, Polly?
Sure. The teachers sent the girls home when they left, even though they only had 24 hours notice that school was shutting down on March 17th, sent them home with some questions. And then in the weeks following that, created academic packets, and we delivered them to all of the girls. So they were just subject specific in all of their different levels that they were in. And then they picked them up, and then we delivered the Education for Life packets. So there's been a lot of effort to try and help the girls stay on track. I will say though that the headmistress found, when she went and visited some in a very poor community, that the girls were out in the fields working. They were burdened with a lot of domestic chores, and it was very hard for many of them to even think about schoolwork. There wasn't maybe in some cases an adult in the house who was supporting, because they just are struggling to survive right now, the families. So we do expect that there's going to be a lot of catching up to do, even though they've tried hard.
Yeah, and I imagine that they'll start with assessments, and that they'll just see, what they need to do to review. And I think that that's, I'm sure, where the teachers will begin and start to focus on, now that we know how soon the girls will be coming back to school. We have, okay.
We have one last question, maybe to help us wrap things up. Vanessa wants to know whether people are able to send letters of encouragement to the students.
Absolutely, people have been sending emails. So I'm not sure if the U.S. postal system has reopened to Tanzania yet. I know they had shut down because the letters go on commercial airlines, but we do have an email that really meant for our sponsors primarily, but during this crisis situation, a lot of other people did want to write. And as I mentioned earlier, I think that was particularly beneficial for the girls' mental health to receive those letters in the last few weeks. Now they're coming back, and so, if people want to send a quick email, they will receive them, and can just be general letter of support to the class, and maybe that's something that the headmistress can read at a school meeting, for example. So absolutely, I think it would be wonderful to share words of encouragement. And if you happen to be a sponsor, I think that the girls, they really love getting your letters. So definitely keep them coming to that particular girl. And as we get the girls back on campus, then they'll be able to get back into the routine of writing letters back, which they do twice a year, and getting academic updates to your sponsors as well. So I know there was one question, I'm not sure if we had answered it, about the matching campaign, that $25,000. I think somebody asked, Sandy Young asked if that was specifically for emergency assistance, and I just wanted to make sure people understood that it is, in fact, for emergency assistance. So I don't know if there's any other questions. Oh, Matt is asking me to share the email, a sponsorship email, which I'll do with all of you. It is SEGA, SEGA.sponsorship@gmail.com, in case people want to send a quick note of support to the girls. So let me see what time it is. I think that is all the time we have for today. I think we've covered most people's questions, but if we missed any, as I mentioned earlier, we will definitely reach out directly to you. But I want to thank the panelists, and I want to thank you all for joining us today. And thank you all for your ongoing support that has enabled us to be responsive during this crisis. We'll definitely keep in touch, and perhaps in another month's time, we can do this again and let you know how the transition has gone and how the return to campus and learning back on our campus has gone. So thank you so much.
Thank you, everyone.
Thank you.
Bye.
Bye-bye.
Thank you.
Bye.